Hi students! In this video we're going to be talking about content that comes from Chapter 2. And we're going to be talking about how behavior modification is used in the real world. And the whole goal is just to give you a sense about how some of the principles we are discussing this term can be used in a wide range of different career and occupational settings. So research shows that behavior modification is used effectively in the following settings. So first and foremost, there's been a lot of research looking at how behavior modification can be used for parenting and child management. Anybody who spends time with young children know that we can use these behavioral principles to change their behaviors and to change the environment such that the child leads a healthier, happier life. With respect to parenting, behavior modification has been used to improve, so that's why I've got the arrow going up, increase language skills, getting children to talk more, getting them to talk more appropriately using polite language. It's also been used to increase toilet training, to increase self-help skills, and so by this we mean things like being able to wash their hands, being able to brush their teeth, being able to take a bath or take a shower, brush their hair, comb their hair. It increases performance with respect to chores. So many families have little chore charts and they use principles of behavior modification to increase the likelihood that a child will help with setting the table or clearing the table or taking the dog for a walk. It's associated with increasing sharing behaviors, especially among siblings, and making healthy choices when it comes to eating. It's also been associated with decreases in tantrums. We've talked about these in a couple of examples so far. It's been associated with decreasing aggressive behaviors, so that could be hitting or kicking or biting or pinching. It's been associated with decreasing in arguments, and this could be between parent and child or between siblings. Non-compliance, and by this we mean kind of defiant behavior, breaking rules, and so it decreases the child's likelihood of engaging in those behaviors, as well as nail biting. And you could put eating junk food in here too. Now, one of the nice things about this particular area of research is it leads to improvements in both the child and the parent's behavior, because again, remember, that's what the whole approach to behavior modification is. It's not that we're trying to fix the child, but we're trying to change the environment such that the child is more effective and the parent is more effective in their parenting as well. So it leads to improvements in both the child and the parent's behavior. Another area where behavior modification is used extensively is in working with populations with developmental disabilities. And we're going to talk about two areas here. So first and foremost, it's been used extensively with individuals who have intellectual disabilities or cognitive disabilities. Now, these might be individuals who score low on traditional measures of intelligence, IQ tests, or have some kind of brain disorder, brain disease, brain impairment. But behavior modification has been used to increase functional self-help skills. So this would be ability to brush their teeth, ability to wash hands, ability to take a shower, to get dressed, to tie shoes. And the more we can increase these self-help skills, the more we can help individuals to lead independent lives. It's also associated with decreases in self-injurious behavior. So if individuals are likely to engage in head banging or slapping or something that could harm them, behavior modification has been used to decrease those kinds of behaviors, as well as decrease aggressive behaviors such as hitting, kicking, slapping, etc. And again, the whole goal is to help individuals have more productive and independent lives. Now, behavior modification is also used, and it's probably the most preferred method of helping individuals that are on the autism spectrum. And so specifically individuals who have autism spectrum disorder, sometimes referred to as ASD. This work was pioneered by the behavior modifier Ivar Lovaas. This is one of the first approaches that was really effective working with individuals with autism spectrum disorder, and it's used very extensively now. Very based on behavior modification principles. So now The most widely used treatment for autism spectrum disorder is sometimes under this category of early intensive behavior intervention, EIBI, and it's all based on principles of behavior modification. It's one of the most widely used approaches to working with individuals with ASD that is used in the United States as well as in Canada. And the whole goal is to be working with children, working with infants as early as possible, using these behavioral principles so that they can function independently and engage in social interactions. So the approach has been used to improve social skills, so that might include language skills as well as eye contact, using appropriate language, interacting with others, engaging in eye contact when interacting with others, engaging in sharing kinds of behaviors. It's also associated with decreases in self-stimulatory behavior. So individuals with ASD sometimes engage in these self-stim behaviors. It might be hand flapping. It might be playing with a little Hot Wheels car and watching the wheels spin over and over and over again. So it's associated with decreasing these self-stimulatory behaviors, repetitive behaviors, and injurious behaviors. As we described earlier, those injurious behaviors could be head banging, they could be face slapping, they could be hair pulling, hair tugging, and behavior modification is associated with decreases here. Again, the whole goal for either of these types of interventions, what we're trying to increase and what we're trying to decrease, the deficits and the excessive behaviors, is to help individuals have more productive, independent, and fulfilling lives. All right, behavior modification has been used extensively in education, and that includes at the preschool level, elementary school, middle, and high school level. It's kind of hard to walk into any kind of a classroom and not see some kind of a chart that is dedicated to how many books have been read this particular week, what are the classroom chores, and what's been finished. So these principles are intertwined in our school system, and they're associated with increases in on-task behavior, being able to be engaging in what the child or adolescent should be doing at the time, turn-taking behavior, reading, math, handwriting, all of these are associated with behavior modification principles, and decreasing out-of-seat behavior, aggressive behavior, tantrums, and bullying. Now, I want to talk a little bit about how our class, specifically how I've tried to integrate behavior modification principles into our class, and that is most clearly aligned with the use of our quizzes in our class. So if you've read through the syllabus, if you've taken a look at the introductory video, you know that we have quizzes. We have weekly quizzes. Now we use these weekly quizzes and we connect them with this approach that was suggested by Keller. It's called a personalized system of instruction, or a PSI. And here's what we do and how this aligns with our quizzes. So I have identified target behaviors, certain amounts of content that I would like you to understand and be aware of and demonstrate competency. I'm going to be assessing your progress in small chunks. That's why we have weekly quizzes. It says frequent tests, but what we mean by this is frequent quizzes. You will be assessed on the material frequently and in small chunks. Oftentimes these kinds of programs are associated with showing mastery criteria before moving on, so that would mean being able to show a high level of competency before you can move on. Now, I let you take the quizzes as many times as possible during the week, but because we are on a quarter system and there's a certain amount of content we have to get through, I don't just let you have unlimited time before moving on. The quizzes are meant to be non-punitive in the sense that you're allowed to try again. There's not a penalty for taking the quiz and not performing well, because you can keep trying. You get immediate feedback regarding your performance, so at least you know where your answers were incorrect. They're self-paced in the sense that there's no time. They don't have to be done in 15 minutes or in 5 minutes. They're self-paced to the extent that we can. And the idea is that the lecture that we give in this class is kind of for demonstration and for review. You are practicing the information on your own, you are reading the content on your own, you're watching the videos as kind of a review for that. So we use a lot of these components of the personalized system of instruction, the PSI, in our quizzes. So behavior modification is also used in many clinical settings. We're just going to touch on some things right now, and we'll talk about these more later in the term. It's used to deal with populations that are exhibiting symptoms of schizophrenia, anxiety disorders and phobias, obsessive compulsive disorders, depression, eating disorders, sexual dysfunction, obesity, marital problems. And so all of these kinds of groups of individuals with these different kinds of disorders and dysfunctions and problems can benefit from behavior modification techniques. Behavior modification is used extensively in sports psychology, so applying psychology principles to working with athletes. It's been used to increase motivation, endurance, how much time somebody can spend on a particular task, as well as proper form. Certain sports have specific form that they have to show to be able to be successful on the task. It's associated with decreasing bad habits, so bad practice habits, negative thoughts, so self-defeating thoughts like, oh, I'm not going to be able to do well on this, as well as decreased stress associated with performance. Behavior modification is used extensively working with older adults in nursing homes and assisted living facilities. It's used to improve social interactions, to improve diet and medicine compliance, and to decrease disruptive behaviors so that the older adults that are living in these different kinds of homes and facilities can have satisfying lives. Behavior modification is used in medical health and rehabilitation, occupational therapy, and physical therapy. So for example, it's used in the treatment of medical conditions, to decrease migraines, backaches, hypertension, and stomach problems. It's used to increase treatment compliance, so maintaining a treatment plan. Often when healthcare providers are working with clients or patients, they need them to take a certain amount of medicine, or they may give them specific exercises or a specific diet to follow, and behavior modification can be used to help them remember to take their medicine, remember to participate in the diet, remember to engage in their activities. It's also associated with promoting healthy living. So eating healthy in terms of dietary restrictions, engaging in exercise, and limiting alcohol. Behavior modification is used in behavioral community psychology, and that's looking at how we influence the behaviors of a large number of people. Now, I'm making these videos right now while we are, as a country, experiencing the COVID-19 pandemic. And so behavioral community psychologists are being used to try to influence the behaviors of large numbers of people. We are trying to get people to engage in social distancing, to wash their hands, to stay home and not go out. That's all using behavioral principles and behavior modification. It's also been used to increase recycling, seatbelt use, condom use, social distancing, which is what we're doing right now, and decrease littering, unsafe driving, drug use, and energy consumption. It is used in business, industry, and government. And sometimes this area is referred to as organizational behavior management, to increase work performance, job safety, job satisfaction, employee management relations, and decrease tardiness, absenteeism, on-the-job accidents, and employee theft. Lastly, we will be using behavior modification with our self-management projects. These are our projects. Remember, we're trying to change our behaviors within this course. So anytime an individual is trying to engage in some kind of self-management, they're trying to improve some behavior, increase some behavior, or decrease another behavior, they will probably be most effective if they use principles of behavior modification. So it can be used to increase studying behavior, exercise, healthful eating, meditation, interview skills, sleeping. These are things that people have done in the past. It can also be used to decrease behaviors, and these would be probably our behavioral excesses: smoking, eating junk food, negative self-statements, and social media time. So I've given you lots of ideas here, and I'm not trying to give you these ideas so that you have them all memorized, but I do want you to see how behavior modification can be used in a wide range of different settings. And I'd like you to really think about your own career path, what you think you want to do when you grow up, and how you can use behavior modification in that path in the future. Because I'm guessing you have lots of ways that you can use this content in your careers in the future. All right? Take care. I'll see you next time.